board today. So for those who aren't able to join us, we'll be sharing that recording. And today, really happy to see you all. We're going to dig deep into the world and services and supports offered by Oregon's Ombuds offices. So really excited to introduce some special guests that are joining us today. Before we get there, I'd like you all to introduce yourselves for these folks. In the interest of time, let's just do that in the chat. But I'm sure we'd all like to know who you are, your pronouns, kind of what part of the state you're coming from, if you represent an agency, an organization, if you're a family or a youth coming into the space. Tell us a little bit about you, and that will be really helpful for our guest presenters. So today we're going to learn a little bit more about the advocacy and case resolution services that are offered through OHA and DHS Ombuds offices. We're going to learn a little bit how they work together when families are impacted by multiple systems and the care they take when working with a family to protect confidentiality and prevent system retaliation. We'll spend some time in breakouts like we usually do, asking you to share if and how your regional system has partnered with Ombuds offices, and hopefully we'll be building an understanding of when and how to refer families in your system to these supports. So with that, I'm going to turn it over to two fabulous people. Kate Drennan is with OHA's Office of the Ombuds people, I guess. Help us with the language. It's such an awkward word. I still can't really seem to say it after all these years. So would love to know your tips on how you say it every day, because it's a really awkward word. And yeah, so we're gonna hear from Kate, and then we're gonna hear from Darren Mancuso, who actually works for the Governor's Advocacy Office. So would love to learn a little bit more about how that is different from ODHS. But Darren works specifically to support families and youth, young people who are involved in the foster care system. Kate and Darren, Tony was not able to join us today, so not going to be able to hear from her. Unfortunately, Tony was going to be joining us from the long-term care ombudsman office, yet another ombuds office specific to residential facilities for those with intellectual and developmental disabilities. So Kate and Darren, if you are able to speak to that office a little bit and how and when you work, that would be great. Yeah, so Kate, floor is yours. Welcome. Thank you so much for being here.
Of course, thank you. Can everyone hear me okay?
Yes.
Awesome, thank you. It's such a pleasure to be here with you this morning or this afternoon. I guess it's afternoon already. Put my afternoon socks on. Would you, Christy, would you like me to share my screen? Because I did bring some slides. Do you want me to just go ahead? Okay. I will do that, and I will present. I think this is maybe 10 or 15 minutes. Sounds like we might, Vera and I might both have a little bit more time since Tony couldn't be with us. But I'll walk through them. I won't be able, probably while I'm presenting, to see in the chat. So please feel free to verbally just grab me and say, hey, someone's got a question. But I think you've designed it, Christy, in such a way that we can present, and then there's time for Q&A and then time for breakouts. So I'll just plan to move through the slides. And feel free to please put questions in the chat. But if there's something that's a burning question, please don't hesitate to interrupt me. I would love it if we were all in the same room together and I could see people's faces and hands. So I'm still adjusting. I feel like I'll be adjusting forever to dealing with Zoom. But let me pull my screen up and share and see if this will do it. I'm so used to Teams. Let's see. Can everybody see that okay?
Yeah, it looks good. If you want to, it's not in the slide view. I don't know if you want to turn that on.
Yeah, let me see if I can get it there. How's that?
That's great.
And I'll make this. All right. Does that look okay to everyone? I can't see anyone, so anybody can. Okay, thank you. All right. I'm now at the part where I'm flying blind. So if you want my attention, say something into my ears and I will be able to hear you. So thank you. And I'm going to try to time myself too so that we move through this efficiently. So it's lovely to be with you all today. I think this is the System of Care Learning Collaborative. I'm still learning all the different iterations. And it is such a pleasure to be with you. Again, my name is Kate Drynan. My pronouns are she, her, and hers. I'm here to talk today a little bit about the Oregon Health Authority Ombuds Office. We'll talk about a little bit about what an ombuds is and what we do. And then I know Darren's going to do the same for his team and his role in particular. But I will just say, I have a history of work in the system of care and wraparound world. And the System of Care Advisory Council, the Learning Collaborative, and all of its iterations and work did not exist when I was doing this work. And so this is just a blessing to be here with you. And it's a dream come true for many of us I know who've been doing this work, many of you longer than I have. So it's a particular pleasure to be here with you all. Let's see. So I'm going to see if I can figure out how to do this. All right, it worked. So today I'll talk a little bit about our Ombuds program, the history and purpose, who we are, what is an Ombuds, who we serve and how we strive to elevate member voice. So I think the first question is, why does the Oregon Health Authority have an Ombuds program? We are, I believe, the only Ombuds program that has enabling legislation, and here is the ORS statute at the top. But our scope is that we are called in legislation to provide ombuds, and Christy, such a good question. How do we say this word? And in particular, always thinking about, gender these days. Often we just abbreviate it to ombuds, and I'll provide a little bit of some of the global translations of the word. It's originally a Swedish word. Sometimes we say ombuds. Traditionally, it's called the ombudsman. I call myself an ombudswoman. One of my colleagues just called herself a buddy. But we respond in any case to people's needs. So we provide ombuds services for Oregon Medicaid recipients. So anyone that receives OHP in any way is within the scope of our purview or membership. And we serve as a recipient's advocate whenever there are concerns about access to care or quality of care or limitations on care. That's when folks come to us or are referred to us. And in the process of working with members, we learn from them what are the places where they are experiencing barriers that are systemic barriers. And we use what we learn from our members to make recommendations to the health authority for improving access to and quality of care. A couple of noteworthy elements. We are under the OHA Director, Supervision and Control. The Oregon Health Authority just hired a new director, and we will report directly to her. We also issue quarterly and annual reports to the governor and to the Oregon Health Policy Board quarterly about the services we've provided, recommendations about the improvement of our own services as a program and a team, and any recommendations that we wish to issue based on our data and member stories about issues of access to care or quality of care. Let's see. Effectively, how I think about this is that we have kind of a twin mandate, which is to work at the case level to help resolve issues of access to or quality of care for members, and then to elevate member voice to improve policy and process is kind of the boil it down, the bottom line. So there are a couple in particular of values that we truly seek to ground ourselves in. We always seek to ground ourselves in equity, in alignment with OHA's goal to eliminate health inequities by 2030. All of our recommendations, we seek to ground them in health equity in alignment with that goal. And the second value, no less equal or important, is that we believe client story is an essential part of transformation. And as part of OHA's commitment to eliminating health inequities and co-creating with community, it is essential for the health authority as an agency to hear, listen, and act on member concerns. I'll talk a little bit more about how we do that toward the end. So, Ombuds, as you said, Christy, funny name, serious work. What the heck does this word mean? I will just say, full disclosure, we straight up stole this tagline from the city of Portland from their Ombuds office. So, funny name, serious work. Full credit to the city of Portland. The name and the concept of having a representative of the people within the government that is set up to serve them originated in Sweden. And so the term ombudsman or ombudsman is Swedish, but there are actually ombuds offices in just about every country in every corner of the world. You can see some of the translations here in Spanish, And in Arabic, I will not do them justice. If I try to say them, I will mispronounce them. But in English, what it means is that we are here to help. And there's one more translation I found recently that really moved me, that speaks to our work, I think, often. In Amharic, it's called the Emba Tebaki, and it means the keeper of the people's tears. And I think that just particularly spoke to me. So I'm just going to look really quick at my notes and see. Oh, I wanted to just quickly define what an ombuds is. I think you heard me say that when I said it's meant to be a representative of the people within the agency or government entity that is designed to serve the people. There are actually two kinds of ombuds. There's numerous different kinds of ombuds, but broadly speaking, ombuds can be impartial ombuds or advocate ombuds. Impartial ombuds look to see was policy followed or not and make that kind of finding. Advocate ombuds take that kind of a step further and say the policy may or may not have been followed, but even if it was followed, is this a policy or a process that is serving people well, or is it inadvertently creating harm? And the OHA ombuds are called in legislature to be advocate ombuds. And so that's the lens that we bring to this work. We look to see were people's rights honored, are their needs being met? And even if those policy and procedures are being followed well, is the members' needs still being met? If not, that's where we really look to try to positively impact policy and process. So who are we here to help? I'm pleased to say that as OHA, many of you may know, has been going through the redetermination process in the wake of the ending of the public health emergency. Oregon, as I was told today, is one of among the top 3 states in the country for the highest amounts of people being able to retain their Oregon health plan. So we're really happy about that. And that means that this statistic is probably going to hold true. Almost 1 in 3 Oregonians are on the Oregon health plan. So just a few words about my team. There are 6 of us that work as ombuds. And then we have a principal ombuds who helps really to lead us in that charge about making recommendations to improve policy and process. And we have a manager. But there are 6 full-time ombuds to work cases. And there are about 1.5 million Oregon health plan members. So we have our work cut out for us. And then maybe just a few more words about my team. We all have a really interesting and quite varied set of backgrounds. We have some of us speak English, some of us speak English and Spanish. We do use translation services as needed, but we are actually currently in the process of hiring another bilingual ombuds. And in all of our hiring practices, we seek to hire in a way that our staff will begin to be more reflective of the priority populations of the health authority. We are also proud to include a senior team member who has lived experience with the mental health system as a young woman and is a certified peer partner and brings that lens to her work. Any of us can serve all cases. Some of us do take the lead if we have subject matter expertise on certain cases and policy. My background is in child and family mental health. And so I sometimes will manage or take the lead on complex cases with youth in need of mental health services, and also help to lead the charge on policy and process reform for that. So I think the next question is, what do some of our cases look like? So when Oregon health plan members have questions and concerns, these are 3 real cases that we've de-identified and brought to you as examples of different kinds of cases that we get, and I'll just read them. One member called us and said, I'm supposed to be able to get a ride to my doctor's appointment. The driver did not pick me up on time to make the appointment, and sometimes this happens repeatedly. My provider is now going to drop me because I've missed so many appointments. Another member called and said, I'm a transgender woman. I need facial feminization surgery. My plan denied it, but did not consider the exception to the rule criteria. A third case, and this is an amalgamation of many cases that we get, my child or a young person in my care needs residential behavioral health treatment and can't access it because there is no capacity. So something I'm sure will sound very familiar to all of you. When OHP members have questions and concerns, how do we help them? The first thing that we do is walk alongside OHP members. We step into their shoes to understand their care challenges. and we seek to help address resolution to their questions and concerns. So the very first thing that we do is ask members, what is the problem and what do you need? We don't seek to try to reframe a member's needs. We listen to them as they tell it to us, and we use their words when we're advocating for them about what it is that they need. So I think some of the questions, Christy, you had put in to ask us to address, I'll just take a few minutes on this slide and think through. I think one of the questions is, what happens when someone might be referred to us and what might we do? So let's go back to that issue of the member whose ride to care through no fault of their own was late and they were at risk for being discharged from their primary care provider. And this is also an amalgamation of many cases that we see. Most primarily, we work with a member's CCO or coordinated care organization, the plan that delivers their Medicaid plan. And that we do have about 10% of those 1.5 million members are on fee-for-service, or sometimes it's called straight Medicaid or open card. And so we will work with a member's CCO or the contractor that is contracted to serve and support fee-for-service members and reach out. Often what we do is ask for a care coordinator to be assigned to work directly with a member. Ombuds don't provide care coordination services, but we know where the care coordinators are and we know who to call to make sure that a care coordinator can be assigned to a member. And if it's a relatively straightforward case, we might say to the member, great, we've got a care coordinator who's got you. Please work with your care coordinator. If that does not go well, you have my direct number. Please call me back and let me know. That might be the simplest case. A slightly more complex case would be this ride to care case. Often what we do is ensure that members understand their rights to file a grievance or a complaint. And so I would support, if this were my member, I would support this member in understanding they have a right to file a grievance. Their relationship with their provider is being put at risk because their ride to care provider is not being timely. And so we would appraise them of their rights. As always, we offer members information and allow them to decide if that's something they want to pursue. And if and when members do file a grievance with their plan, they have a right to receive a written response within 30 days addressing their grievance. In this instance, I might also ask a member if they would like to be connected to a care coordinator to try to troubleshoot a little bit what's happening with the care provider and make sure that member can remain connected to their PCP, or if that relationship is, if that member is being discharged, to work with that member to ensure that they can find a new primary care provider. And as an ombuds, I would ask the care coordinator to report back to me to let me know what the outcome is. And I also follow up with the member to make sure that the member is satisfied with that. But I think there's another question here as well about that third scenario. What happens when there are really complex cases, young people in need of behavioral health care and residential care? We all know that these are really complicated cases and the wait times are terrible. And often resources that are needed in the community aren't there. So in this instance, we as ombuds work with any and all partners that need to be brought to the table to help understand what is this particular young person's need, how do we address it? So I might assemble, the ombuds have the power to convene across system staffing. I might ask people to come together from the plan, my OHA behavioral health colleagues, from DHS and child welfare, Medicaid leadership, whoever needs to be at the table. I can convene for a single or an ongoing staffing, or if someone else is convening, ombuds can join it and ensure that we're representing the members' needs and that we're all collectively understanding what the barriers are and working to resolve that outcome. So those are just a couple of examples of different kinds of ways that members' cases might be addressed. I think we just have a few more slides here. What to expect when you contact the Ombuds program. Most of our referrals are direct referrals. A member will call themselves. Sometimes someone will call on behalf of their child or the young person in their care. Sometimes providers or colleagues will send members to us. It's good to know that the Ombuds is not an emergency service. We will respond within 3 to 5 working days, although I'm going to put a little star there and say we do sometimes get urgent cases and we will respond either the same day or next day if they're tagged as urgent cases, particularly if there's any risk associated that we can discern from the case, either a member's intent to self-harm, or if their health condition has deteriorated sufficiently that we're alarmed enough to get back quickly. We are not necessarily the first place to call when there's an issue. We always encourage members to make sure that they've either already reached out to their CCO or coordinated care organization or CSU, client services unit. I think it's the wording here says should always be contacted first. I put another star next to this one because members often come to us first. Usually I'll say, does your care coordination organization or your plan know that you're in need of help? And if you haven't already talked to them, can we loop them in? Because they may not know that you need help and they might like to know that you need help so that they can provide it. So we usually try to ensure that we're not necessarily the first area of resort, but if people contact us first, it's not a problem. I want to assure everybody, we don't say things like, you have to talk to your CCO first before you talk to us. We have an open door. We do try to understand the issue, engage proper teams for support. Again, this could be the CCO, their provider, OHA, other state agencies, or agencies out of state as needed. We do respect member privacy by not sharing their personal information with anyone that is not authorized. We can receive information from anyone, but we can't share and won't share back information without a release from a member. And this is just a link to the, it's a 3010 form that provides that release of information form. Let's see, and I think this last piece that I want to touch on is that is all in the service of working with members and case resolution. But that second part of the twin mandate that I referenced earlier is how do we elevate our members' voices so that they can directly impact, positively impact policy and process. When we see problems, either a trend in the data or a single case that tells us if this is happening to one member, we know without question it's happening to more. We bring it up within the Oregon Health Authority and make a plan to fix the system causing the problem. One of the chief ways that we do this is through our Ombuds reports. We publish annual reports with data, and we always issue recommendations that are bolstered by data, stories, and recommendations that are always rooted in what our members teach us to support policy and process improvement. And then the Oregon Health Systems Division, which administers the Oregon Health Plan, provides a formal response to the Ombuds year-end recommendations. They do treat our reports as formal audits and do keep a log of the recommendations that we make and of their progress on those recommendations. All the reports and responses are available on the Ombuds webpage. You can see the link below. And I do want to just call out that I'm so pleased to be able to say that our annual report from 2022 focused exclusively on adult mental health and substance use disorder issues. We felt very strongly that age is also an equity issue, and I really did help lead the charge in partnership with so many folks on the phone here, our behavioral, child and family behavioral health colleagues, to create a 2023 Ombuds 6-month report that focuses exclusively on the mental health needs of young children, youth, and families in Oregon. And that is live on our webpage and can be accessed there. And I think the last question is where to call with questions, concerns, complaints about access to or quality of care. As always, it's useful to get in touch with your CCO or client services unit. And I think information for CCOs can be found there. But if you're unable to get your problem taken care of, or if, and I think you referenced this early on, Christy, if there are concerns about confidentiality, retaliation, we always welcome members to call us directly. And the simplest way to do that is to call us toll free or email us or send a secure email from the Ombuds website. We don't yet have anybody able to answer the calls live. That is a hope that we have. We'd have to expand our capacity first, but folks can leave us a voicemail and we will get back within that kind of 1 to 2 or 3 to 5 days, depending on urgency. So that is all for me. I'm going to stop sharing. Nope. Let me see. I'm going to figure out how to stop sharing and then I will come back to you. So, Christy,
Great.
I can't see anybody yet. You can let me know. There it goes. If anybody has questions or if we want to just wait and have Darren present and then take questions, I'm in your hands.
Thank you, Kate. Let's pause for a second for questions. I have one. There was a acronym on a slide that I missed it. You probably said it and I missed it. It was CCO or CSU. What is CSU?
Yes, I'm so glad you asked. CSU is what we call our Client Services Unit. And it's kind of like OHP member services. And I can put that share back up if that's helpful, or I think you all have the PowerPoint. So, and I can type it into the chat too, their
Great.
Contact information. Yeah.
Thank you. Yeah, I will send slides out to everybody today.
Oh, good.
Yeah.
Thank you.
What questions do y'all have for Kate?
I will say I love Ombuds human. Thank you. That's so fabulous. My oldest is genderqueer, and so I continually pull them about their ideas for how we continue to gussy up and keep the name updated. Julia,
So
JB.
I'm also a genderqueer person, and I was the one who put that in the chat, so I appreciate that. Or Ombuds person, or something like that. Until we can all get in our head that some other gender neutral term, we'll come up with it. Eventually,
Yes.
we like to do that as humans, create language. So
We do. I do. And actually, my oldest is pretty funny because every now and then when they get there, they don't live at home anymore. They're out and about. But we continue to have this conversation, and every now and then, like, don't worry about it, Mom. It's moving so fast that by this time next week it'll have changed again. But I'll keep you updated. So they're part of my link to stay.
Great to have that link. Yes,
it is. It is. It's my direct family link as well as my professional ongoing growth. So thank you, JB. I love that.
Of course. I just had I don't know if you'll be able to answer this, but just a general question about, you kind of put it in a slide, like when is an appropriate time to reach out to Ombuds? And I've actually spoken to you, Darren. Good to see you. But I got pulled in. I've been pulled into Ombuds conversations, but not initiated it myself. And so I guess my question is, at what point is it like, and I know that'll vary based off the situation and very specific, but at what point is it like, okay, we need to pull in someone from the Ombuds office?
Yeah, I think your question is such a good one. And I think you're right in that without like a lot of context, the answer is probably, it depends. I've been hearing that from our colleagues in the EPSD, the early periodic screening detection world. It depends. But I guess what I would want to say is the short answer that I want people to know is there's really no wrong time to call us, because let's say you're uncertain and you err on the side of calling us. We're going to assign the case out and someone's going to get back to you, and you could just consult and you could say, I'm either calling on behalf of myself or I'm calling on behalf of a client or a family member, and this is the situation. Can you just help us understand, like, give us some guidance? Is this you guys, or what would you recommend we try? So I don't think there's a downside to calling us. So that's what I'm going to land on, JB, is when in doubt, you can call us. There's not like a litmus test. We're not going to be like, this doesn't really meet the criteria for Ombuds. I was reading on another state agency website that there is, I think it might have been the Department of Education. I think they have to sort of make a finding about whether the complaint rises to the level of some magic, flip the switch thing, and then it's legitimate. It's not the case with the Ombuds office. When in doubt, you can call us. Is that helpful?
Very. Just to know we can call to consult is huge. Thank you.
100%. Thank you for the question.
I guess my question is around what kind of response time do you have for folks who call you?
Like for an initial call, or?
Yeah. How fast should they expect to hear back?
Yes. Our ideal is if the case is emergent. So if there's any concern that a member is leaving a voicemail where we're concerned about their risk level, we're just going to flag that as a same or next day get back. Those are assigned urgently. So same day or next day. I actually have to make return an urgent call after this meeting. But generally speaking, we aim for 3 to 5 days to return calls. I think it used to be we aimed for 1 to 3. We're developmentally, I forgot to say this, we're developmentally a little bit still of a young team. I think we've been in existence for 4 years. One of the most recent recommendations that we put out about how we can improve our own process is that if we're given more resource for staff, because as the word has been getting out, our call volume has been steadily creeping up, which is excellent. And we're feeling that a little bit. So we strive for that 3 to 5 day window. Sometimes it's sooner. We try not to go past 5. Is that helpful, Hillary?
Yeah, that's great. And I appreciate all the work that you all do to take essentially complaints and try and solve them for folks.
Thank you. I will say, I don't think we really have I was thinking about this when I was preparing to give this talk. I don't think we really have like a way to summarize and assess how frequently we're successful or to what degrees we're successful. We're not always able to be successful. And I try to really be direct and clearly communicate that to members. What I always say is, I can't guarantee the outcome of my work on your behalf, but I guarantee that I will do my best to get you all the way there, or at least part of the way there, and to take your voice forward. Hi, Carol.
Hi, Kate. It's good to see you.
It's good to see you.
You just sort of lit a question for me. When you're not successful, is it because of, and this may be too broad a question, but is it because of limited system resources? Is it because of humans bumping into one another? Do you have a sort of sense of that?
Yeah, like what the buckets of categories of our barriers are, if
Yeah.
you will. Yes, and I can probably give you more information offline about that. Or you may see some of them if you wanted to take the time to read our reports and our recommendations. But sort of just briefly to respond to that, it's such a good question. It's always so frustrating when we can't secure for a member what they need. Some of the more straightforward and frustrating barriers would be things like members might call us and say, I really need this surgery, this medical procedure, this piece of DME, durable medical equipment, that's not covered by the Oregon Health Plan. And we would go to bat for them to make an exception. We would look and see, I think folks are probably familiar with the prioritized list, but the list of everything that every medical condition you could have, every treatment it's paired with, and then there's a line drawn partway through that list. And what's above the list is funded, what's below the line is not funded. But sometimes if there's a member with a condition that's not funded but there's a co-occurring condition like depression, it might pop it up above the line. We would do our diligence to say, oh, maybe there's a co-occurring depression here that pops your condition above the line, and bring that back to the CCO. But if not, sometimes we're in a position of having to say to a member, I'm so sorry, it just isn't covered. We went to bat for you to ask the CTO to cover it anyway. They're within their right to decline it. So that would be a more simpler, straightforward barrier. The humans bumping into each other, the system barriers, those are frequent and numerous. Those are the ones that we try to take aim at with our data and our recommendations. For example, lack of adequate residential care. We can turn ourselves inside out and in our advocacy and not create more residential space. However, the member story that's featured in our 6-month report, this young person, there were not adequate community supports in their rural area. And this young member went to, I think, 3 or 4 different states and was in residential care, varying, this will be a very familiar story. As ombuds, I was able to convene Medicaid leadership, plan leadership, and psychiatric hospital leadership, and convene kind of at that level and make a very specific plan to bring that young member home. We were then able to work with the plan to ask them to stand up what is called, and I'm getting into the weeds a little bit here, but I think it's important, a single case agreement, where providers that are not typically contracted with that plan in that region are engaged in a contract so that there can be safe discharge and step back down to the community. That's an example of something that's much harder, where the system barriers, lack of resources are in place. So I know that's not a full answer, but I hope it gives you some of the ideas of things we run into.
Yeah, thank you so much. And thank you for all your work.
Yeah, thank you. I'm glad to be able to be here and do it. So, Well, I want to be thoughtful too, Darren, of your time. Darren has so much to share. We work often together, and I think the world of Darren and of your work. So I do want to see the rest of the time and be sure you have the time to share your work, and then glad to take more questions too.
Thank you. I appreciate it, Kate. And yeah, I will follow up here. Can I share my screen? Because I think because we do have a little more time, I'll jump through a few PowerPoint slides as well that'll give some information. So let me share my screen, see if I can get it to the right one. Okay. Wow, it's just gone all over the place. New share, where'd it go? It ran away. There we are. Can y'all see the screen? Yes?
Yes.
Yes.
I wonder if you want to put it on the slideshow view?
Yes, let me do that.
Oh,
File, no, that didn't work.
I think if you, yeah. So, if you go over
Oh,
to
slideshow, there it
there you
is.
go. Yeah, I know it took
From
me a minute to
beginning,
find it too.
ta-da. Okay, how about that?
Perfect.
Perfect, okay.
Fabulous.
You know, and I'm gonna skip a few slides. And I think Kate did justice to explaining what an Ombuds is. I've been called an Ombuddy, so there's a new one for you as well. So I think Kate did a lot of justice with that. I'll kind of start with this slide, which just a few different nomenclatures, examples, descriptions of our work. We are confidential, and that's one of the, I think, key pieces of our work at the Governor's Advocacy Office is being that confidential person. So it's very critical, that element. Also point out in October is Ombudsman Day. It's an international day. So Governor Kate Brown did a proclamation back in 2019, which was pretty cool. So we actually had quite a get together and sharing a little bit about our work in Salem. So that was really fun to do. So let's talk a little bit about the Governor's Advocacy Office, and I'll just shorten that by saying GAO. And we've been around since 1993, so we're on our 30th year, which is really hard to believe that the agency's been around for that long. Initially, our office was held at the governor's office, and we were part of the governor's office with a couple ombuds that were for the entire state of Oregon. And they soon found out, of course, that there were a lot of calls and concerns regarding DHS. At that time, it would have been, gosh, I don't even know, CSD, something maybe even before that. I think it would have been CSD in the early 90s, Children's Services Division. So there were a lot of calls and complaints about Children's Services Division. And the governor's office decided we need to have a specialized unit that is really here to support the folks that are impacted by anything to do with child welfare, and created our office. And then we moved under the director of DHS, under CSD at that time. We've since transitioned, and we're still there. We're under the director of DHS, which is Fairbours Pax and as you all know, structurally, Fairbours is the director of DHS, and DHS is one of has several programs underneath it. Intellectual and developmental disabilities is under DHS, child welfare, of course, APD, adult protective services, self-sufficiency, what am I missing? Vocational rehabilitation. They are all under DHS. So our office actually serves all of those different individual departments under DHS. And we're here to kind of handle any type of complaint, concern regarding anybody who is receiving services from any of those entities. Okay, and then the second part I'm just going to share while I'm on this slide is that we also have a couple other elements within our office at the Governor's Advocacy Office, and one is we have a obligation, a statutory obligation as the children's advocate under the it's actually under ORS 182-500, and allows us the ability to investigate any of CPS's endeavors. So when child welfare is doing their initial assessments, looking at removing children from their parents, our role under the Children's Advocate allows us to engage, to investigate, to make sure that they are following policy and procedure at that initial phase. So that's a specific role within our office that we all hold, and we will often handle cases in that lens. In 2002, our office also became the Customer Service and Client Discrimination Formal Complaint Process and Investigation Unit. And there should be a big, huge acronym for that. We just say that, well, that's Jason, which is Jason Winnig in our office, who handles that position. And so he's our formal discrimination complaint investigator. So in every single DHS office in the state of Oregon, there is a 0170 form, which is a complaint form that anyone can fill out, and they can handwrite into the DHS office, or they could send it to our office. And if it comes to our office, that is assigned to Jason, who then works on that complaint with the managers of that office. He is also our discrimination complaint investigator. So it handles any type of complaint that has something to do with discrimination, whether that's age, race, gender, and really has some specific guidelines, federal guidance that he has to follow under that process. In 2014, the Foster Children Bill of Rights was created. And that was created by Senate Bill 123 and was really at the voice of foster children here in the state of Oregon, and developed not only the Foster Children Bill of Rights, but also my role as the foster care ombudsman, where I've been since 2014. And we have on here the future, right? Because our office has always kind of, I don't know, maybe within some type of somebody's lens or perspective that, yeah, maybe they should move. Maybe they shouldn't be under DHS. Maybe there should be a foster parent ombudsman. Maybe there should be a parent ombudsman. So there's a lot of questions like that. And there's been some legislation in recent years that have asked for those things. Nothing has passed, but we never know where we're going to land when legislation is coming our way. So, much like Kate indicated, our office is here to really help anybody that's been affected by anything to do with any of the DHS programs. We receive complaints and calls from anyone and everyone in the state of Oregon. And we also act on behalf of the governor. So if the governor's office receives a complaint that my son was removed from me by child welfare and I want you to fix that, the governor will send that complaint to our office for us to review and respond accordingly. So that's where the governor's piece still remains in there. And we have that obligation to respond on behalf of the governor. We get complaints from everybody, though. I had a judge reach out to me a couple weeks ago, had a complaint about some things that the judge heard in the courtroom. We have attorneys, we have therapists, we have treatment programs all over the state. Of course, parents. I think one of my big callers, and I don't know if this is true or not, I've got to run some data, it's got to be grandparents. It seems like I have probably talked to every grandparent in the state of Oregon in the last couple of months, I'm quite sure. But a lot of relatives reach out to us, and they're in really an unfortunate situation when their family is involved with child welfare. There's so many elements of confidentiality that they're just not privy to information, and so they're at a loss, and they find us and reach out to us. But again, we will hear from anybody. As I mentioned, our office today, we have a screener. We have our formal complaint coordinator, civil rights investigator, Jason. We have a director. We have 6 ODHS ombuds, which we refer to as kind of generalist ombuds, who will pick up the phone, and one complaint will be regarding self-sufficiency. My food stamps were removed and I need assistance. And the next one will be a parent who said their child was removed and they need assistance from child welfare. So it really flexes in their work, but there's 6 ombuds in that area, and then myself as the foster care ombudsman. As Kate mentioned, we too come from a really broad and diverse background, professional background. We have folks with child welfare experience, victim advocacy, mental health arena. I came from juvenile justice myself, was a drug court coordinator, and worked as a juvenile court counselor for 20 some years before coming to this arena. So we have a wealth of background, and that's really kind of something that is important. One of the elements of an ombuds is to be a neutral third party. And so in essence, we're not really supposed to be in our office subject matter experts. It's really, we're supposed to have a neutral third party objective look at a situation and make a determination of whether it's the agency's following procedures and protocols and Oregon administrative rules. And so that's kind of our lens, is to really look at it from that neutral aspect. Here's a little bit about our office, and this was 2022. And is just kind of an indication of the volume of cases we receive. This was around 3,000 cases, if I remember correctly. The total N number was 3,000 for that year. But as you can see, over 50% of our cases are child welfare. And we say in our office, yes, quantitatively 50% are child welfare, but probably 75% of our time is spent in child welfare land. Aging and people with disability is 20.8, self-sufficiency is 11.7, Office of Training and Investigative Services is less than 1%, intellectual developmental disabilities 2.5, Oregon Health Plan eligibility kind of pieces are 1.2. So you can see very, very small numbers. A lot of what we're doing is in child welfare. Some of the other programs, such as like self-sufficiency, we were meeting today and talking about it, that it's very concrete. There's federal guidelines. You make X amount of dollars and this is what you're eligible for. And so the complaints that we receive in that area are usually rather quick and easy, not easy, but easier to resolve than per se a child welfare situation where it's very subjective. What is best interest of the child? Is it best interest for the child to be placed at this foster home or that one? Or, so there's a lot of subjectivity in child welfare that we're dealing with. I think a couple things, there's no really typical case within our office, of course, but to kind of piggyback on what Kate was talking about, our office has an obligation to respond within 2 days to all complaints, all calls that come to us. And again, we email, voicemail. We do have a screener who answers a lot of our calls, but many do go to voicemail, and our screener will oftentimes call back and try to get additional information, set our cases up. We still receive actually cases, complaints through snail mail, and sometimes those are coming from the correctional facilities throughout the state. We receive faxes from time to time as well. So any way that they can come in, but we have an obligation to respond within 2 days. And that first response is really just an acknowledgement saying, we received your information. We might have additional questions at that time. Please help us understand this or that. And then we start diving into the case. In our office, we have access to all of ODHS electronic systems. So for child welfare, it's ORCIDS, which has, case notes from a child welfare worker who's putting in notes, visitation notes, court orders, psychological evaluations, CASA reports, CRB reports, Citizen Review Board reports, anything and everything that is in a file, we have access to at our fingertips. So we're looking at those in those areas and making decisions about what we need to dive into, what we need to look at to help us determine the appropriateness of this situation. Kate talked a little bit about advocacy and the different kind of roles of an ombuds, and our office is really in a position to advocate for the adherence to Oregon administrative rules and policies and procedures. We don't typically advocate for a person who may have a specific outcome that is outside of policy. And so we're really advocating for adherence to the policy. Okay, so the only caveat to that, I would say, is my role. My role is a little bit different. As the foster care ombudsman, you know, foster children have a Bill of Rights, and there's rights in there like to be able to dress in the clothing that I think is appropriate to my own culture, my gender of my choice, things of that nature. Those are elements that I'm advocating for in more of an advocacy role. Now, those are also in policy, so it's kind of both ways. I advocated for a piercing. Some of you may know what it's called. I forget the name now. It's piercing under the lip. It's like viper piercing or something. I had to Google it. I don't know these things. So I was advocating for a piercing just a few weeks ago with child welfare. So there is some advocacy in my arena, but more often than not, it's that the agency is following policies and laws and procedures. There's some areas that we do not get involved in, and in child welfare, all cases are legal, right? Every single child has an attorney appointed to them. Every mother and father have an attorney appointed to them. So regarding the specific reasons why the agency removed the child from them, that is filed in a petition that goes to court, and the judge is reviewing that. We may review it from a lens, an administrative lens of saying, did child welfare follow the process and protocol per policy? Did they do X, Y, and Z? Did they notify the appropriate people? Did they look at alternatives? Did they look at all family members as options before placing this child with a non-relative? We're going to look at it from that aspect, whereas the judge is going to be looking at that removal from a parent from a legal aspect of, did child welfare meet the burden of reasonable efforts to remove this child, right? Did they provide enough support and services, or is there enough of an immediate danger to this child that this child had to be removed? And so it's a fine line, administrative as well as legal, but ours is the administrative, and we have to steer clear of what the court will be deciding on. So that's one area that we kind of stay away from. We're not attorneys, so we're not giving legal advice in any way. And I think one of the unique elements of our office too is that everybody that we are perhaps going to is a DHS employee, nearly everybody. Child welfare are all DHS employees and caseworkers. APD are also case managers. They're employed by the state, if not the county. Developmental disabilities case managers are either by the case or by the county or the state. And so they're all employed within the same entity. And it's kind of a unique balance that we have to do. We have a lot of situations that folks want to report to us, conflicts of interest, things that are unethical and unprofessional, and we don't investigate those. We hand those over to HR within DHS, and they have a whole team who have investigators and that will work on those issues. Now, we will follow that. as ombudsman and make sure that it's addressed. And if we're not satisfied with how they addressed it, we will escalate that higher and higher. But it's something that we don't do independently. That's really the HR's kind of process. So I think we're getting really close on time, and I want to be clear. This is a presentation that our office does all over the state, probably about an hour and a half presentation where we go through a lot of elements of our job, of our what we're doing, and then we go into the Foster Children Bill of Rights, how that was developed, and the statutes behind it, and the importance of it. We provide this for just about anybody and everybody who wants that type of presentation. So if you're interested, please let me know, and I'm happy to do that. But I want to be mindful of the time and leave plenty of time for questions. I think earlier there was a question, Chrissy or Hillary, regarding the long-term care ombudsman's office. And, you know, I've worked with them for quite some time. And in fact, when I became an ombudsman, I went to their office and was part of their initial training. And it was a pretty intensive 2-week long training at their office, 40 hours a week. And so really learned a lot about what they do. And I think most of us know the long-term care ombudsman's office, where they have volunteers who are all over the state of Oregon and go into a lot of the adult living situations and homes and retirement homes and centers. And they are there kind of checking and handling complaints on site. Tony Larson's program, the residential facility ombudsman, is an offshoot. They're under the umbrella of the long-term care ombudsman. And they too have volunteers all over the state and are going out to residential facilities, developmental disability treatment homes for kids and adults all over the state, and checking on the compliance and checking in with the clientele that are receiving services in those homes. So our office interacts with them from time to time, and there's times where we'll get a phone call where it's really more advocacy based. Somebody wants an advocate. That's probably more appropriate for Tony's group to dive into. If there's calls where it'd be really helpful to have somebody go on site and have eyes on a situation, to meet with a person individually, privately, to see their room, to see where they're living. That's something that we may work in concert with Tony's group, because they do have volunteers all over the state that can do that. Our office, we're an office of 8. We do not go out and visit with folks individually, right? And it was interesting when Kate was talking about the triage and really saying urgent, and we have a call to make that's urgent. Our office actually doesn't even do that. And we will treat a call that comes from the janitor, that their food stamps were removed, the same as a call that we received from the governor saying, can you look into this situation, right? And we look at those as really an important aspect of our job, is about equity and fairness to everyone. And so when we look at that tenet of equity and fairness, we treat everybody the same. And so there are times, though, when it would be wonderful to be able to go out and drive over to a facility or a program, or meet with Billy at the foster home over in Salem, or go. I've had kids say, "Can you come to my court hearing?" There's times that it'd be great to do that, but unfortunately, because there's only one of me, that's impossible. And if I can't do it for all, then I won't do it for one, right? That's part of the equity and fairness piece. So I think I'll end there. That might be a good place to end. I see we have some questions, and I'm happy to try to answer any questions that y'all have.
Thank you so much, Darren. Yeah, questions. Brian asked in the chat, do you review the closed at screening calls to ODHS that the caller asks for a second look? Brian, do you want to say anything more about that?
And I guess I'd like to clarify that. So I had a youth that had juvenile involvement, was on release conditions, was in DHS's care and custody for medical mistreatment from the parents, but placed back with mom. We got a phone call from a law enforcement agency. The youth was passed out drunk in a wheelchair in a crosswalk. I call and make a mandatory report, is closed at screening. I call back and ask for a second look, and I'm told there's nothing I can do. I mean, if I can't get a mandatory report through that, why am I calling for anything? I know he's 15, but my question is, who investigates that for the next step up? Is there a mechanism that trips to let you guys know? Because if you're the foster care, right? If that case not being investigated or closed at screening is mind-boggling to me. I mean, welcome to the state of Oregon, but that hurts my heart that a 15-year-old in a wheelchair, passed out drunk, closed at screening, in DHS custody, in a foster placement, closed at screening.
Yeah, Brian, that hurts my heart too. And that is a perfect call to our office. And that would be assigned immediately to one of us. We do have access to review child welfare screening decisions, and we do that every single day. Our office gets calls about that. So we would be happy to do that. Maybe you and I can connect later on, and you can provide names and we can dive right in and see what's going on with that.
And I mean, I guess my follow-up question on that after that is, how do we make sure that parents and individuals, now granted, I'm in the South Coast, I'm from Coos County. I have 3 CCOs that we're going to deal with that none of them work well together. So I have Coos, which is one CCO, I have Curry, which is a different CCO, and I have Western, and I have Douglas. I put kids in full restraints and drive them 90 miles one direction to go to the doctor because the CCOs will not collaborate, won't do it. That's not trauma informed, it's not best practice, it's horrible. And as the adults, I think we should do better. I mean, I just put that out there for the group that I think it's easy for us to talk about. We're doing great in surface level, whatever, but when we get down to actually the deliverables, we're falling short, at least in the rural areas. And I want to voice that. I feel like the further we get from the I-5 corridor, and specifically about Eugene to the harder it is to get services. So that's just, and with that, I'm going to be quiet. So,
Brian, I appreciate what you're saying, and I'm going to actually be down that neck of the woods, I think in December, and Coos and Gold Beach, and doing some presentations for CASA and for foster parents and for child welfare. And I hear the same from all the 3 of those entities, that the lack of services in the South Coast is really, really difficult, whether it's dental or mental health or, you know, any of the above. And if you have a child who needs any type of specialized services, good luck, get in line, and it's just not happening. So happy to collaborate with you and see what we can do, but please let's talk about that call to the hotline. And I've been working on one the last couple of days that I got from an attorney down your neck of the woods as well, and we were able to get it opened up and looked at. Right, there's human error that happens quite often, and it's important that there is a second look sometimes. So we're happy to do that. Kate, do you want to?
Yeah, I just wanted to piggyback. Thank you so much, Darren, for addressing that. And Brian, just to say, I think I love presenting with you, Darren, because I think it gives us the opportunity to illustrate where cases might come to you, where cases might come to Ombuds, where it's appropriate to engage both of us. That second piece that I just heard you say, Brian, you're putting youth in your own car and driving them 90 miles to get care because CCOs are not working together. Please call us. Full stop. That's part of our job too. Limitations on care, quality of care, CCOs not following through with meeting members' needs. That's OHA, Ombuds. And often, I think one of the questions you had, Christy, is how do we work together? Whenever I get a case that may involve foster youth, Darren's the first person I think of. I think the same is often true for you, Darren, and also for your GAO colleagues. We have a kind of a inbox back and forth, you know, we'll catch your case, send it to you, you catch a case and send it to us. Sometimes we're both partnering together to work 2 ends of a case. This case that you just brought, Brian, is a great example of where Darren, you and I might each take a piece of that case and either staff it, you know, in partnership or parallel or, you know, co-staff. So just a word to say thank you for sharing that. That's hard to hear. We're keenly aware in our office of the lack of resources in rural communities. The story I shared earlier about the youth who sought treatment in, I think, 3 other states was also coming from a very rural area. So thank you for sharing it. It hurts our hearts to hear those too. And please call us.
Chrissy asks, are youth able to call you directly? Or is it a you or a youth support specialist? I guess, is there some sort of age limit to which you would take a call?
There's no age limit at all. And I think the youngest I talked to was a 7-year-old little girl not too long ago, and had a really great conversation with her. But there's nothing, youth can call me directly. Youth can call me with somebody. If it irrelevant to me, right? If it has to be on Saturday morning during cartoons while they're visiting at grandma's house, so be it. I will make myself available Saturday morning and just mute my cartoons on my end, and so we can have that phone call. But I will make myself available. Much like Kate said, our office is not a 24/7 hotline kind of a situation. We're Monday through Friday, 9 to 5. I have a complaint. I need some assistance. But we do get those calls. So we do get emergency calls, and try to respond as quickly as possible and address those. But we will make ourselves available to make sure that we are meeting a caller wherever they need to be, in whatever language, in whatever format. And if it's on a weekend, or if it's, hey, can you call me back at McNary High School tomorrow at 2:20 and have me pull out of my classroom, and I'll go to my counselor's office so we can have a phone call. That works wherever, whenever.
Yeah, this is Gracie. I asked the question in the chat. So I work at Youth Era, and I supervise staff that work with youth, and many times youth that are in foster care. And I feel like a lot of the experiences that they would share with only like their peer, like have come up in what you talk about that you could support with. So I was really thankful that y'all came and did this presentation, because I didn't know what an Ombuds was, and I was looking forward to it. So I think this is really important for peers to know about, because oftentimes, yeah, we're the ones who hear certain scenarios, situations, and et cetera. And we will do mandatory reports, but sometimes mandatory reports, who knows what happens with those sometimes. And so, yeah, thank you for presenting.
Yeah, I'm happy to come out and present and talk to youth anytime, anywhere as well. So always make that available. And I know I've talked to a few staff from Youth Era just in the last 6 months, probably a handful of cases. So keep them coming. And to answer, an earlier question, to me, there's no situation that's too small or too big. And I really mean that. We've had some high level situations, and had people let go from the agency and no longer, work in this field anymore as a result of phone calls. And we've had things as, I get broccoli for dinner 3 times a week, right? And anything and everything in between. Yeah, broccoli, I don't know. But so, anything and everything. It doesn't matter to me. It is a crime. So yeah, happy to help out in any way we can.
I think maybe it's important to say, some of the folks on here are kind of on the other side, and there can sometimes be fear from agencies of making that call, etc., or handing over an ombuds person's information because you work for the agency, and what's the blowback going to be to you professionally if you encourage somebody to make that call. I mean, I kind of feel like Chelsea Holcomb and I will run a time for families, and very few families call in, and I think some of it is that people don't, in professional roles, don't necessarily want to say, hey, family member, go call this line and tell them all these bad things that we've not done for you. And so I just want to air that as a thing, and just to encourage people to really think about how important it is often for someone to have a voice, and that when you do that for somebody, you've enabled them to advocacy for themselves. And yes, it's hard for us as agencies to hear those things and to then have to go sort them. And yes, there may be some pain, but no pain without gain, really. And just encouraging you to offer these as resources to people. So.
And confidential resources, I think, is the other element, Hillary. I mean, I talked to a manager from Kairos this week. I've talked to a foster parent. Child welfare is going to call them resource parents and confuse us all, but I talked to a foster parent today who said, "Can you not use my name?" Absolutely, right? And in policy and in law, there's protections from our office regarding no retaliation. And it's hard. And I'm going to tell you that there's times where I'm pretty confident that retaliation happened, but it's very difficult to prove. And it's dicey, right? And even if I keep somebody anonymous, child welfare can put one and one together and likely come up with three and figure out who that caller is, right? Based on the questions I'm asking. So now sometimes they're wrong, and I tell them the short story about how I had a supervisor asking me who it was and thought it was a foster parent, and it actually happened to be the director of the agency who was asking me to look into a situation. So I want to give that caution, but retaliation, we've had that happen a couple times, and people have been reprimanded for that. And in fact, recently down in Southern Oregon, on the Southern Oregon coast, that happened. So, but yeah, we're happy to, let our caller be the driver in the complaint, to really just say, here's some options, here's what we can do, what do you want to do, and let them be the driver. Or as Kate said, it can be merely consultation. We can just say, hey, here's some options, here's why they're doing it, here's the policy behind it, and help people understand it. Speaking DHS is like a foreign language, and I've learned to kind of speak it, I'm sad to say, in a way, but I can speak it. I don't live it, but I can speak it, and I can help people understand sometimes why they're doing what they're doing. Sometimes, not all the time. Sometimes I'm baffled just as much as anybody else, but yeah.
We do. Thank you so much, Hillary, for sharing that. We do also experience with innumerable clients who call us, I'm really worried about what the repercussions are going to be to me. And we do you said that so beautifully, Darren. Yep. We just let the client be the driver. We always center their needs, and we start with what difficulties are you experiencing? Let me be sure I'm hearing them right. And sometimes people will say to us, "Oh my God, thank you just for hearing me and believing me," right? Which isn't yet sufficient, but is often something that goes lacking when people tell their stories. So we try our best to be trauma informed and to purposefully reflect back. You're telling me this is the pain you're in. These are the things you've tried. This is where you're blocked. This is what you need that you're not getting. Got it. And then we do kind of just the same. We'll lay out a menu of different options in plain language so that people can understand it, and then say, you get to tell me what you might want me to do. I serve at your pleasure. So you are in the driver's seat, and you get to choose what, if, or any of these paths that we've just outlined. And we do, as best we can, deal with issues of confidentiality. At some point, a couple of months ago, I had a member who needed to file a complaint with a different state agency, and there were substantive issues. She was from an African country. There were language and cultural issues. She had wartime and interpersonal violence trauma, and there were confidentiality issues about the department that she needed to allege. And it was really, really difficult. One of the things that I did, and I want to point out, because I think many of us on the Ombuds team try to do this, is I said, who in your world is supportive of you? Who is advocating for you already? Who do you turn to? Would you like to invite that person to be on the phone with us, to just be by your side? So we welcome people to come into those kinds of calls that in a way that would reassure members. And I was able to lay out some potential pathways to help safely, this member feel safe and confident in moving forward. We did engage somebody who's a community advocate for her, and the three of us, we made a huddle, and then we made a little plan that we all agreed to. And then we each took some small steps, and eventually she was able to get to that department and allege that complaint in a way that protected her confidentiality and didn't trigger her PTSD. So I just want to say I think Darren and I are singing from the same page about when members come to us, we keenly keep in mind concerns that they have about confidentiality, protection, retaliation, the consequence of that. Other questions or other feedback that you might have for us, things you want us to think about that are important that you hear from families and youth?
So just real quick, I want to throw out something positive and then I'll be done for the day. But so I want
Keep
to
going, Brian.
I want to say thank you. I've been doing this for 22 years. I've been a director for 12 years. I had no idea you guys even existed. None. I can tell you I regularly communicate with DHS, other entities. It just feels like there's this brick wall that you can't get past. They give you no more information, and that's just too bad. You live with it. Or we have kids die with it, frankly. So I frankly, I'll be take the gloves off. You guys are probably going to be the best call I had or the best meeting I had today. Not that I accomplished one thing, but my information of being able to forward this and help families advocate in an appropriate manner, that it's not just me being the pain in everyone's side down here on an ongoing basis. Legitimately, probably my most important meeting of the day today, just because I actually have information that isn't just me being a pain to some of the people down here. So thank you for having this meeting today. And sorry it took me 22 years or the last 12 years to find you. So
and I'm going to add my thanks. We had our first, there was a report around 6 months ago, and I got upset because it didn't say anything about children, or not very much about children. So I went and complained to Kate and her boss and others, and so that this is what has generated the youth report that they've done, that they then took the information apart and have given us that first look. And it is so important that we ask people to be accountable for the work they're doing and to shine a spotlight on young people within that. So, I thank you for reflecting that. And Darren, while I was with CASA in Lynn County, we did use you a couple of times, quite a few years ago. So again, just had lots of positive experiences with the Ombuds teams in different agencies, and just really thank you for all your work.
Glad to be able to be of service. I will say I was so grateful for your advocacy, Hillary, about that report, because when we were writing the annual report, I felt like I was the voice on the team that kept saying, and kids, and youth, and the children. And through no lack of commitment, I really want to clarify on our manager or leadership or my colleagues' part, really it's truly a matter of capacity. And we're actually putting our brains to how we can increase our capacity both to serve and to continue to issue reports like that, because we know that sometimes that's part of the toolkit that goes into system change. But it was helpful to be able to have both, I think, my voice inside and your voices outside saying, and the children. So I was very glad and grateful. It's the thing I'm happiest about in 2023, that I got the green light to help push that forward. So yeah, happy it's moving forward. And it's such a pleasure to be here with you all. I'm so glad. I know I said this at the outset, but it's such a thrill to see a system of care advisory council enabled by legislation and accountable to the governor, and that is so populated with the voices and the stories and the leadership of young people, youth, and families. So thank you very much for having us.
Thank you all so much. I realize it's almost 4:30. We didn't do breakouts, which was fine. We had a pretty small group, so glad we all got to be together for the Q&A. I've got one last question for you, though, if I might add, is what system of care partners and regional system of care partners, system of care advisory council, like how can we be a support to Ombuds? It feels like spreading the word and giving information to people would be a big one. I'm still kind of floored that we had people who were like, I've never heard of this before. So, or maybe not surprised, I don't know. State agencies often have some communication challenges. Is there anything else that we can do as a system to be a support to you in the work that you're all doing?
I think
For me,
getting the word
oh,
out
yeah.
there. I was just thinking, get the word out there, like from a system perspective, like because it wasn't until I got I knew about ombudsman, but I didn't really understand how accessible you all were and what your kind of the scope of your role was until I got involved in a specific complaint. So yeah, like I'm going to share this with all my teams in Multnomah County that you, not to flood y'all, but you may be getting some calls.
Please do. And honestly, from my perspective, I think one of the things that is so, you know, along with not having a ton of resource, we don't have like a ton of resource to help get the word out, as Brian said. You know, people continue to know more about who we are and that we're here and how we're here. I think one of the one sector that I would love to see know more about us is child welfare, because every now and then child welfare folks accidentally find their way to the ombuds and are like, what again? And what is Medicaid? And how does what is the CCO? And how does that even work? So anything that folks can do to help spread the word, because, you know, of course, now we have two agencies. We have DHS and we have OHA. And yea, verily, when we create more than one state agency, we divide families into, you know, different buckets of need and different places we ask them to go. And it continues to be confusing and overwhelming. So to the extent that we can sort of, I think, cross-populate information about what exists in the DHS world from the GAO office and the OHA office, but particularly from our end to the child welfare folks, that would be wonderful. And look forward to the ongoing conversation about how we sort of jointly leverage each other's work and lift each other's work to improve the continuum of care and the policies and process that go into that. I don't know, Darren, if you have other thoughts.
I don't have anything really more than what you said. I think, you know, making sure that folks know about us is such a huge piece. And as Brian indicated earlier, that's sad to me that folks aren't aware of our office, and we've been around for 30 years, right? So please, and share that information so people that are impacted negatively can reach out to us, and perhaps we can help them. I will say too, we can't help everybody. There's times where there's barriers, bumping into people, bumping into policies and procedures, conflicts, you know, of different dogmas. There's things that we can't help with, but there's times where we can. And many times, as Kate mentioned earlier, just being a voice and validating a person and actually hearing them and their concerns has such a huge impact on people. And so we're happy to be able to do that as well. We're willing to go out and present anywhere, anytime. So if there's folks out there that say, come to my neck of the woods, we're happy to do that.
I would just like to say that I really appreciate this. It gives me some hope. I'm from Tillamook and we have so few resources here. And unfortunately, anything I've ever heard about ombuds in Tillamook has been very negative. You know, well, it doesn't help, you know, they don't call back or they didn't do anything. And, you know, this has been some time ago, but it's like the people that I know have not bothered to call because of whatever previous negative experiences they have. So I'm really excited, and I believe you people are doing a great job, and I'm certainly going to share that. And I can think of so many people right now that I wish had called. And I just want to say that as many meetings as I go to, this is one of the few that it's like, wow, I really learned a lot, and I'm glad I was here.
Thank you, Jane.
Wonderful. On that note, thank you all so much. Please look for recording and slides and other resources that you can share. Keep sharing the great supports and services. And yes, let's continue this conversation, Kate and Darren, because I would love to dig into chapter 2 around leveraging our mutual efforts. I think there's a lot of power to be had there. So
Indeed.
hope you all have a lovely afternoon. Take care. We'll see you next time.
Thank you all. Thanks for having us.
Bye.
Bye-bye.